استعمال الأدوية من منظور علم الأمراض. يعرف عن نبدأ مع محاضرة بعنوان سمية الأدوية والجرعات الدوائية المفرطة وإساءة استعمال الأدوية من منظور علم الأمراض. يعرف عن الدكتور المحاضر الدكتور غسان الشنان، وهو خبير لمنظمة الصحة العالمية والمدير السابق لبرامج صندوق التمويل العالمي في سوريا. تفضلوا.
صباح الخير. اليوم الجلسة الحقيقة هي عن موضوع حيحكي لنا فيها طبيب أخصائي بالهيستوباثولوجي. Yeah, we can see you. We can see the slide.
Okay, that's excellent.
Yeah. Okay.
So in this case, there's no problem. I was looking for. Anyway, thank you very much for inviting me to give you talk in your conference. This deals with the toxicology at the end of life and beyond. And I'm just going to give you a brief summary from review and literature and others. And let me start, please. So, toxicology investigations. First, when we do this, we have to take samples, and this includes blood samples, male blood, and the amount should be around 10 to 20 mils, and also some preserved blood, 5 mils. And this will give us the way to analyze the targeted drug screens and the beta-hydroxybutyrate and other substances. The preserved blood is mainly for alcohol, ethanol, and ethyl glycol and other volatile substances. Also we take plain and preserved urine, and urine is important sample because the drugs passes the liver and blood to go to urine, and that's indicating that the substance was taken for certainty. We also take sometimes a vitreous fluid, that's fluid from the eye, and that's the most important in case of decomposition, and will be the most accurate sample, because the vitreous fluid will not be influenced by the bacterial overgrowth in the body. And we take also preserved vitreous, the same like blood. Other samples we may take, it's from the stomach content, and we look at the stomach content to see if there's any medication, and that doesn't give indication that the medication is absorbed, but at least it gives us an idea that this has been taken. We take liver tissue, about 10 grams, to analyze drug in this. Sometimes muscle tissue, brain tissue, lung tissue, and hair. The biochemical investigation from vitreous fluid, the concentration of urea and creatinine are important to assess the renal function and the status of the renal function as well. Vitreous sodium is also important, and it's sort of decline in postmortem period, depends on the variability of body storage condition. The vitreous potassium also important. Other investigations include assessment of acetone and beta-hydroxybutyrate. Glycated hemoglobin, HbA1c, is important to assess the diabetes and the whether the diabetes under control or not. Vitreous humor glucose concentration is important and much more stable than the glucose in the blood and in the serum. So we also use drug screening for targeted drugs, and there are several instruments used for this. I'm not going through this, mainly mass spectrophotometry and liquid chromatography and gas chromatography. There are a variety of instruments for assessment of drug screening and quantification of drugs. Carboxyhemoglobin and carbon monoxide analysis is important, and this is important in case of fire, whether fire in a car or fire in the house, and this will give us an idea whether the person inhaled the gas, and this can be assessed in the blood. Immunological investigation, sometimes patient might die from hypersensitivity reaction and anaphylactic shock, and we use mast cell tryptase and IgE for the assessment of anaphylactic shock. So as I mentioned, that a variety of instruments can be used, and also and add to this enzyme immunoassay, spectrophotometry and infrared spectrophotometry. So the analytical toxicology is mainly for blood, serum and urine, and this covers ethanol, paracetamol, salicylate and other drugs. We also use this assessment to check the therapeutic drugs and see whether the therapeutic drugs above and or below the normal level. And variety of drugs can be measured, like digoxin, clonazepam, and other drug use and for inpatients. Antipsychotic drugs, this is very common way of either drug overdose or drug toxicity, and these are all familiar to you, and sertraline is one of the most common drugs used. Now, it is important to know how to interpret the results. I mean, we get values, but we need to know what the value of this and the level of toxicity and the level that can lead to death. And it's important to know the drug reference range, and this is obtained from several studies in the past. The one important factor is the postmortem drug redistribution. That's after death, the drug can be redistributed from the tissue into the blood. It's very unusual phenomenon. So one example of this methadone can be redistributed. So when we get the figures, we need to know how long the patient died for before doing the postmortem examination. So we also need to assess or know the drug formation. Sometimes the bacteria can cause fermentation of glucose and produce ethanol in the body, but not very high amount of this. Drug stability in postmortem period before and after sampling, and then drug interaction, drugs in life. As you know, that there is drug interaction, and this may lead to toxicity even in therapeutic levels. And we need to know the pharmacogenetics of these medications. I just want to give you an example of compound toxic effect. And for instance, young male known with history of drug misuse, and the preserved blood sample showed cocaine 42 nanogram per ml, and benzoquinine or metabolites of cocaine 480 nanogram per ml. The total morphine was 220 nanogram per ml, and the free morphine 212 nanogram per ml. So with this analysis, the level of free morphine to the total morphine is very high, indicating acute or recent intake of morphine. So with this one, you can see that there is morphine taken recently and cocaine, and that's both have synergistic effects on the cause of death. The amount of morphine, free morphine and morphine by itself can cause death, but here an example of both cocaine and morphine as combined toxic effect, and this is a cause of death in this. Another example of combined toxic effect, middle age, late, known with a history of drug misuse. Ethanol in the blood was not detected, but we found blood gamma hydroxybutyrate 29 milligram per liter, and the total morphine 72 nanogram, and the free morphine is 55. It's less than the other one I have shown you. So the gamma hydroxybutyrate was detected at concentration has previously known or associated with toxicity and fatality. So by itself, this value is a toxic, and there was also metabolite of cocaine 480 nanogram per ml. So that's indicate that the person had taken gamma hydroxybutyrate and also morphine and cannabis, and this is all these drugs had effect on the respiratory system and central nervous depressed system, and the drugs can cause death through this mechanism. And mainly these drugs affect the cardiorespiratory center in the brain. Another example, middle age with known history of drug misuse on methadone treatment. As you know, that methadone is given for patients who are or were on drug misuse, and the blood ethanol was 357 per 100 ml. The preserved urine ethanol 456. And methadone in the blood was 600 nanogram per ml. The therapeutic range should be between 75 to 1,100, and toxic range 200 and to 2,000 nanogram. You can see here the values. There's overlap between the lethal range and the toxic range, and also the therapeutic range for methadone. So the interpretation has to be accurate in terms of if you want to consider it as a cause of death. But if we look at the values of the ethanol here, that the value of ethanol in the urine is very high, indicating that the person had taken recently alcohol, and this amount of alcohol in the urine and blood enough to kill a person without methadone. But the person also was on sertraline, and the level of sertraline in the blood was 225 nanogram. The therapeutic range is within the therapeutic range, but this is an example where that the combined effect of sertraline and methadone, in spite of the fact that they are within the therapeutic range, with alcohol that can lead to fatality and death. So this is an example of combined toxic effect of alcohol and other drugs. So I'll give you another example. Patient who was on methadone treatment, and I think this is the same one. I just want to give you an example of acute ethanol toxicity. A young male found lying in bed with no pulse. Postmortem showed no abnormality in the heart, because we look at the heart for a heart problem, but when we did the blood ethanol and the urine ethanol, the blood ethanol was 393 milligram, and the urine 400. So this is very high level of alcohol. So the person died from ethanol toxicity, and we call this acute toxicity because there's evidence of acute intake prior to death. It's an example of chronic ethanol intake, middle-aged male with a known history of ethanol intake, and the CT postmortem found no significant abnormality other than fatty liver. The fatty liver occur as a result of the chronic intake, as you know, and the level of blood ethanol was 101 milligram, is not very high, and the urine 93 is very just above the normal or what expected, and citalopram blood level was 222. The therapeutic range is up to 350, so it is within the therapeutic range. But we found that beta hydroxybutyrate 3.8 millimole per liter. The range, normal range, should be less than 0.5. So you can see that beta hydroxybutyrate is very high, and the carboxyhemoglobin HbA1c 34 millimole per liter, and it is within the normal range. So what we have here is beta hydroxybutyrate, and this is evidence of in relation to therapeutic citalopram that has been used prior to death, and the patient developed after that or during life course septicemia, and we found the cause of death in that. But we put the cause of death as fatty liver secondary to septicemia and chronic ethanol intake. So there was no acute ethanol intake at the time of death. I just want to give you an example of how a drug can cause toxicity to the liver and might lead to death. Drug toxicity is very, very common these days. So many people on medications, and this can cause, as you know, a variety of injuries. But the liver is the most common organ that gets these injuries because it's the site of metabolism. And here is an example of a person who had septic shock and was or given antibiotics, and at postmortem CT we didn't find anything significant, but histology examination showed evidence of drug-induced injury. So the patient was treated with antibiotic agent, and that led to injury to the bile duct and causes cholestasis and liver failure. Blood culture showed Klebsiella pneumonia organisms, and the patient had septicemia and then had also cellulitis. So he died later on, and this is an example of cholestatic drug-induced liver disease secondary to septicemia and secondary to cellulitis. And the antibiotics, the effect of antibiotics on the liver, it's like immune response and can lead to injury to bile duct. Sometimes we don't find the cause of death, and here is a case where a lot of investigations done and we couldn't find the cause of death, so we call it unascertained cause of death. Ischemic heart disease, heart problem is so common these days, and this is an example of a person who had hepatitis C and was on alcohol dependence, and the investigation showed the preserved blood of ethanol 27 milligram per 100 ml, and the vitreous fluid was not detected. So it's important that the alcohol here is not from the intake, is from the body decomposition. But on investigation, we found that the calcium score for the coronary artery is very high, and the patient died of ischemic heart disease secondary to atherosclerosis of the coronary arteries. So the cause of death is not related to the alcohol dependence or hepatitis C. Another example of how a person might die, and we find that it's not the drug that kills a person, it's a natural cause of death. Sometimes we find sudden adult death in young people, and this is an example whereby the heart weight was 490, the heart should be about 350 grams, and with further investigation there are no toxicological findings to explain the cause of death. So we put this as sudden adult death, and this is can be related to families. The families should be investigated as well. This is an example of a person who was on epilepsy, and the person was on levetiracetam. You know these more than me, and the drug level in the blood was less than 1.2 milligram per liter, the therapeutic range 10 to 37. And you can see here that the person did not take the drugs. Not taking the drugs in this condition might lead to epileptic shock as well. And what we found is at postmortem there was left ventricular hypertrophy, and the low level of the medication may be or possibly lead to seizures and sudden unexplained death in epilepsy. So this is called SUDIP, and may be seen from time to time. So the measuring the blood level of these drugs, not only for overdose, but also to assess the therapeutic range and the relation to cause of death. This is an example of a person who was on ethanol and just died suddenly. The postmortem examination showed gynecomastia and hepatic fatty liver related to dysfunction of the liver, and because of the long-term ethanol intake. At the time of the death, that the ethanol level was very, just above the normal expected range in blood and urine. The citalopram in the blood was 222, and it is within the normal range. Beta-hydroxyproteinase and this one as an example of sudden death, and is related to fatty liver as well. Some examples of asphyxia, we get cases of say hanging, and the hanging is obvious cause of death, but we do toxicology for this to see whether the person had taken drugs or ethanol prior to alcohol prior to death. And asphyxia can cause death by cessation of the circulation of the blood in the brain for a couple of minutes, and which lead to death. Another example of natural cause of death in a person who was on medication, and we measured the morphine, we measured the citalopram and so on, and codeine, and we didn't find a relation to the cause of death, but we found pulmonary embolism and thrombosis, and we put the cause of death as natural cause of death in a person who was on drugs. Drowning can be from within river or in the sea. The drowning in the sea is far more effective in terms of the injury to the person. And what we found in these, that if a person died of drowning, blood within the, water from the river or the sea in the stomach, as well as in the bronchial tree, and we examine these. But we always do toxicology for these in case if a person had taken some drugs or alcohol prior to drowning. And here is an example of the ketamine level was 3,365 nanogram therapeutic range. It is within the therapeutic range, but still it's important. The cocaine level was small, and morphine level was small. So the ketamine will have caused significant sedation, and that might lead to the person to drown in the water as a result of this. So drowning lead to asphyxia, and then it leads to death. Just an example of the multiple injuries. Person died in a car crash, or person on the bicycle and hit by a car driver. We look at the toxicology on this, and we look at the level of ethanol and other drugs, and we found that the person had a high level of ethanol in the blood. If you look at the vitreous level is 158 nanogram per 100 ml. This is very high, and this is indication that the person who was on the bicycle had taken alcohol, and this, of course, lead to a problem. The alcohol with this level can lead to loss of concentration and the impairment of perception, if you want to, during cycling, and it might lead to impaired the balance, and of course the multiple injury was secondary to ethanol intoxication. So it's an example of measuring the alcohol in the vitreous fluid from the eye. It's the most accurate way of assessing alcohol. And thank you very much.